today's lecture we'll be discussing these following things. Number one, clinical roles of the ECG. Number two, what do we expect from the ECG? And number three, who should perform the ECG? Now our focus about these three things, and we should start step by step and discuss every of them one by one. First, ECG is one of the most reliable or not reliable. In some book has been mentioned. ECG is electrocardiogram. Is one of the most wide clinical tool that we use for different cardiac problems. ECG, one of the most widely diagnostic tool, which is used most commonly, not only in cardiology, and in another clinical practice. They should also know about the ECG, and they should also interpret the ECG. Now, clinical role of the ECG. ECG is one of the most widely used and useful investigation in contemporary medicine, because ECG is one of the oldest, simplest, cheapest, and easily portable electromedical equipment, which immediately provides information about the different clinical problems. Particularly, it is very important for cases of arrhythmia. In addition to that is essential for diagnosis of arrhythmia. The ECG test is a guide for the therapy, especially for guide of therapy in case of arrhythmia. For example, we see this patient have got ventricular tachycardia. We diagnose the ventricular tachycardia. For ventricular tachycardia, when Maris hemodynamically not stable, immediately we do for the patient DC shock. So ECG is one of the most widely used and useful investigation in contemporary medicine, because it is oldest, simplest, cheapest, easily portable electromedical instrument which provide valuable information immediately, especially about the arrhythmia. And therefore, for the diagnosis of arrhythmia, we can use it as a guide of therapy. I will summarize the clinical role of ECG here one by one. ECG is essential for diagnosis of arrhythmia. And therefore, we use it as a guide of therapy for the treatment of arrhythmia. Number one, ECG is extremely useful for diagnosis of acute myocardial infarction, for short AMI. ECG is also helpful for the causes of the chest pain. Or before we discuss about the chest pain, ECG is helpful for making decision of the thrombolytic agent or fibrinolytic agent in those patients who have got chest pain, and the chest pain associated with this T-segment elevation or LBB. In such a case, one of the thrombolytic agent, TPRT+ should be given if the patient come to the clinical presentation with the onset of the chest pain should not be past more than 6 or 12 hours. In such a case, one of the thrombolytic agent is should given as a primary pharmacological revascularization. This was the second clinical role. The third one, ECG is helpful for the causes of the chest pain. Cardiac pain should be differentiated from pulmonary pains, from gastrointestinal pain, from anterior chest wall syndrome. For example, cardiac pains due to ischemia, especially angina, unstable angina, non-ischemia, ischemia, aortic dissection, and pericarditis should be differentiated from other pulmonary pains. For example, pulmonary pains like pulmonary embolism, tension pneumothorax, and pneumonia, and inflammation of the pleura, pleurisy. Secondly, the chest pain, cardiac pain should be differentiated from which pain? From gastrointestinal pain. For example, from reflexive esophagitis, gastritis, or pancreatitis, cholecystitis. In these cases should be differentiated from cardiac pain. Finally, cardiac pain should be differentiated from anterior chest wall syndrome, which include herpes zoster, costochondritis or thyroid disease, and cervical arthrosis. This is the second indication of the chest pain for differential diagnosis of the cardiac chest pain from pulmonary pain, and from gastrointestinal pain, and from anterior chest wall syndrome. Another one, ECG is helpful for causes of dyspnea. For example, cardiac dyspnea should be differentiated from pulmonary dyspnea. For example, cardiac dyspnea on patients who have got chest pain, who have got CHF or congestive heart failure, and pulmonary edema. These dyspnea should be differentiated from pulmonary dyspnea. Again, pulmonary embolism, tension pneumothorax, COPD, bronchial asthma, these dyspnea should be differentiated from cardiac dyspnea. And finally, ECG is a helpful clue. ECG is a helpful clue for those patients who have got systemic disorders. For example, electrolyte abnormalities. If electrolyte abnormalities in cases of hyperkalemia, hypokalemia, hypercalcemia, and hypocalcemia. ECG is helpful in this situation. And finally, ECG is helpful, as I mentioned before, in other diseases. For example, thyrotoxicosis, Addison, myxoidine, and in these cases also, ECG is a helpful clue. Finally, as I mentioned before, ECG is one of the widely used and useful investigation in contemporary medicine because it is oldest, simplest, cheapest, and easily portable electromedical equipment which provides valuable information immediately after the taking of the ECG. Now, but remember, ECG is not a 100% diagnostic tool. It means ECG does not give for all diseases a quite or nice diagnosis. Just it is essential for arrhythmia. So ECG is widely used in useful investigation. ECG is not a 100% diagnostic tool. But still the diagnosis of the patient depends on history, to a lesser extent on physical examination. ECG just provides evidence to support diagnosis. In addition of the ECG, we have other diagnostic tools that is used for diagnosis of cardiac problem. For example, chest X-ray is simple. Chest X-ray provides information about the cardiac chambers, cardiac size, and sometimes we will see white mediastin, which represent aortic dissection. Chest X-ray, the second echo. Echo provides valuable information about the cardiac structural disease. For example, congenital heart diseases, valvular heart diseases, wall motion abnormalities, and pericardial effusion. These things is in this sense, echocardiography is very helpful. In addition to that, ECG, echocardiography provide information about the cardiac function. Normal cardiac function is accepted as a range of 60%. Less than 60, I mean 40 to 45%, this is a systolic heart failure. More than 70%, this is called diastolic heart failure. This was about the role of echo. Stress echo is also used for some cases, especially for motion abnormality of the ventricles. PET, positron emission tomography. This is used just for differential diagnosis of acute or fresh MI from board MI, I mean a scar.
Of course,
This was PET, positron emission tomography. On CT, CT is also used for diagnosis of cardiac problem. For example, CT angio is used for diagnosis of atherosclerotic plaque and calcification of the coronary artery is used CT with angio. Another MRI. MRI provides a high resolution image of the cardiac as well as great vessels of the heart. This is the role of MRI. Catheterization. This provides useful information about the cardiac chambers pressure. Cardiac chambers pressure is helped by catheterization. And the last one, scintigraphy study. Scintigraphy study is a diagnostic tool that we use for diagnosis of ischemic heart disease. For example, differential diagnosis. It provides information about the MI or ischemia, but it does not differentiate acute MI from old MI. I mean hot spot and cold spot. Scintigraphy study. Finally, a definite diagnostic tool for coronary artery diseases is angiography. This angiography provides information about the degree and severity of the obstruction of the coronary diseases. This was about the angiography. In addition to angiography, you have got some lab tests which support the diagnosis. For example, troponin T and I. This is very helpful for those people who have got STEMI from non-STEMI. This troponin test is used in the 6 hours of the starting of the MI. CKMB, another ALT and LDH. And another one is ANT, atrial nephropeptide hormone, which is used for diagnosis of heart failure. So troponin A, T and I, CK and B, ALT, LDH and ANP. This was the diagnostic tool that we use for cardiac problems. It means ECG is not 100% diagnostic tool, but we use another test for diagnosis of different cardiac problems. Who should perform the ECG? This is also a nice issue to talk about that. Who should perform the ECG? ECG is one of the most common investigations which should be performed or which could be performed by these group of the people. Physicians, in outpatients or in hospital admission patients, physicians should know about the ECG. Especially they use this ECG in outpatient as well as those patients who are admitted in the ward. They should also, this physician should learn the ECG or should perform the ECG. Surgeon, look, they every day come and they consult with us the ECG. The second point or the second person should be surgeon. Surgeon should know about the ECG. This is as a preoperative workup. Preoperative workup. They should not consult only a simple cases or a normal ECG. They know about the ECG. If they face to a complicated case, they should refer to the expert of the ECG or to cardiologist. Surgeon, GP, general practitioner, in well person and screening clinic. For example, you work in your private clinic as a physician or as a general practitioner, he should know about the ECG. He should learn the ECG and he should know the taking of the ECG. The second, nursing stuff on CCU and ICU. Look, even the nurse should know about the ECG. Finally, paramedics on emergency call. A paramedic and emergency call, they should also know about the ECG or they should perform the ECG. Dentist and anesthetist. These are the people that they should learn about the ECG. Now, interpretation of the ECG or interpreting of the ECG involves recognition of the pattern of the ECG. If you don't know about the pattern of the ECG, we can't interpret the ECG. So, interpretation of the ECG and recognition of the pattern of the ECG are fairly straightforward for cardiologists and those who read ECG every day. It means interpretation of the ECG and reporting of the ECG is easy for cardiologists and for those who read ECG every day. But for some other group, it produces a big problem, especially those who, even those people that they don't know even about the basics of the ECG. For those guys that the ECG sometimes produces a problem, they are the category of the people who are training. Number two, not expert in ECG and who are not confident about their report in regarding of ECG. These three categories people should learn ECG and practice ECG. During the course of this ECG, we'll try and we focus about 3 points. Number one, we should know about the normal ECG, at least about the correct diagnosis. During this ECG course, we should first correct diagnosis. Number two, appropriate action. What does it mean, appropriate action? For example, you see a patient with ventricular tachycardia. Again, this patient have got immunocompromised patient. Immediate appropriate action of what is DC shock. Appropriate action. And finally, expert opinion is essential. Those people have got experience about the ECG, you should consult with that one in these cases, or you should refer this patient to cardiologist. This was about the expert opinion. In addition to these three things, I mean correct diagnosis, appropriate action, and finally expert opinion, we should focus about these things and we should provide a suitable answer for these urgent cases. What is our urgent cases? Number one, who should I interpret the ECG? Who should I interpret the ECG? In this lecture, we will discuss these matters step by step. Even we have discussed these matters in our bedside teaching. Who should interpret the ECG? Number 2, when we check a ECG, you find abnormalities. You think, are these abnormalities are significant or not significant? Number 3, how should they distinguish or differentiate it supraventricular from ventricular arrhythmia? This point is very important to those people who want to learn ECG. First of all, who should interpret the ECG? Number 2, are these abnormalities are significant? How should I distinguish SVT from ventricular tachycardia? Number 4, how should I make diagnosis of acute myocardial infarction? And finally, where should prefer this patient to the cardiologist, or when we refer this patient to cardiologist? In addition of that, during the interpretation of the ECG, you should learn about the QT interval, PR interval, and QRS interval. Yes, today was our ECG a little bit short. I think this was our today's lecture. Thank you from your